If you have high cholesterol or any form of cardiovascular disease, then it's likely that you've been prescribed a statin. You've probably been told they'll dramatically lower your cholesterol and reduce your risk of heart attack by more than 30%. But did you know that some experts argue that in many cases statins are best avoided? The reason being, the heart attack reduction statistics are manipulated, lowering cholesterol isn't always a good thing, and statins can have serious side effects, including depleting one of the most essential nutrients for a healthy heart. We'll discover the truth behind these claims in just a moment, plus we'll uncover why lowering cholesterol can be problematic. But before we jump in, please take a sec to like this video and subscribe to our channel. We've got amazing new content each week. Also stick around because later in this video we'll show you how to receive 2 free gifts on us. First off, I'd like to draw your attention to a 2009 study. This study analysed the cholesterol levels of 136,905 people hospitalised with coronary artery disease. They found 75% of the patients had normal levels or below of LDL cholesterol, otherwise known as the bad cholesterol. This study flies in the face of conventional wisdom that tells us high cholesterol is the cause of heart attacks. Hence why a number of doctors argue that lower cholesterol isn't always cardioprotective. In fact, an increasing amount of evidence suggests that inflammation is the root cause of heart disease and not cholesterol. A 2005 landmark paper published in the New England Journal of Medicine explained the science of this. Basically, white blood cells are driven into the arterial wall to protect the walls from oxidized, damaged cholesterol. The white blood cells then absorb the damaged cholesterol, thus causing a build-up of plaque which eventually can block arteries. What's important to note here is that it's only damaged cholesterol that is absorbed by the white blood cells, not healthy cholesterol. And what is unhealthy cholesterol caused by? Inflammation. Lowering cholesterol doesn't prevent it from being damaged. In fact, there is evidence that lower cholesterol can cause more health issues. For example, it predisposes to cancer and infectious diseases. This begs the question, do we really want to reduce it? Especially when we take into account that statins can cause harmful side effects. Plus, there are superior ways to reduce inflammation that don't have a long list of negative side effects. Some studies are showing that statins do little to even reduce the rate of deaths caused by heart attacks. For example, Swedish researchers analysed data on people between the ages of 40 and 79. In this age bracket, statin use had increased threefold between 1998 and 2002, but yet it had no impact on reducing cardiovascular disease. Before we explore the side effects of statins, there are some points to consider. If you lower LDL or bad cholesterol but have low levels of HDL good cholesterol, taking statins will be of no help. The same is said for inflammation. Lowering LDL without lowering inflammation will prove statins useless according to a 2008 study. For women with high cholesterol, there is no proof that taking statins will lower cardiovascular events risk or risk of death. A trial discovered that 2 medications that lowered cholesterol significantly more than another drug actually increased the build-up of arterial plaque. These cholesterol-lowering drugs did nothing to lower heart attack risk. Older individuals with lower cholesterol have increased risk of death than individuals with higher cholesterol. And for both men and women over 69 years of age with elevated cholesterol, there's no evidence that statins lowers risk of heart attacks or death. This leads me to the side effects associated with statins, a list of over 300 adverse health effects. Firstly, a side effect commonly associated with statins is diabetes. Considering diabetes dramatically increases risk of cardiovascular disease, this is concerning. Reviews on all the studies on statins and diabetes show that taking them increases your risk of developing this condition by about 10%. Another side effect that is most disturbing is the effect statins can have on muscles. There are over 100 studies demonstrating their muscle-harming effects, and over 80 demonstrating their effects on nerve damage. This drug has the potential to cause damage to the entire body when we consider the large proportion of the body that's made up of muscles and coordinating nerve system. Not to mention that the heart is also a muscle, one that never rests. An obvious red flag goes up. In 2009, a human study was published in the Journal of Clinical Cardiology. This demonstrated that statins do in fact weaken the heart muscle. Although these results seemed shocking to others, they were perhaps unsurprising, as some researchers had already realised that statins disrupt something called the mevalonate pathway. This pathway helps produce the essential nutrient called coenzyme Q10, CoQ10. A deficiency in this can be a major contributing factor to cardiovascular disease. Aside from CoQ10, research is indicating that statin drugs can deplete the body of cardioprotective minerals such as zinc and selenium. Additionally, a study published in the Journal of Diabetes found that statins can result in peripheral neuropathy. This is a condition where nerves located outside of the brain and spinal cord, peripheral nerves, are damaged. It often causes weakness, numbness and pain, usually in the hands and feet. Peripheral neuropathy can also affect other bodily functions, including digestion, urination and circulation. It's normally associated with diabetes and can lead to ulcers forming on limbs, which can eventually lead to amputation. As we can see, the side effects of these drugs can be serious. But what do the statistics show when it comes to the efficacy of this group of pharmaceuticals? Are they manipulated? We're about to discover the truth behind the research on statins. First, if you can't get enough of these tips for improving your heart health, then why not download our free ebook, The Surprising Truth About Fat and Cholesterol? And if you'd really like to understand the full picture for fighting and preventing heart disease, check out episode 1 of The Untold Story of Heart Disease. Both gifts are free and waiting for you now. Just click the link in the description below. Advocates for statins say they have a success rate of 36% reduction in heart attacks. However, this statistic isn't exactly true. It is gleaned by a method called relative reduction, whereas a more accurate method is absolute reduction. Let's look at the difference between these two methods. Take, for example, a study of 200 people and split them into two groups. 100 people take a placebo and 100 take a statin. Let's say 3 people die taking the placebo and only 2 who took the statin. Would you agree that this is a 1% risk reduction? And yes, that is true when we use absolute risk reduction. However, some drug companies call this a 30% risk reduction. This is because it is a relative risk reduction. The reality of 1% is a lot less compelling than the 30% drug companies advertise. This explains why people have started to question whether taking statins is worth the gamble. Aside from the manipulation of data, there is also a concept in medicine called number needed to treat, or NNT for short. This enables researchers to analyse the efficacy and risks of a treatment. This provides information on how many people who receive statins receive benefits, as well as how many experience side effects. A group of scientists and doctors who receive no industry funding have analysed the literature on various medical topics and created a platform to record it. It can be found at www.thennt.com. When it came to statins, they found that in individuals with no pre-existing cardiovascular disease who took statins for a 5-year period, 0 lives were saved. In the same group, the statins helped prevent a heart attack in 1 out of 104 people, which is the equivalent to 1.6%, and aided to prevent a stroke in 1 out of 154, which is 0.37%. Hardly impressive statistics. Aside from these dismissal benefits from these studies, we can also glean the NN8, which means the number need to harm. This gives us a good indication of how many people experience side effects. According to these independent researchers, for individuals who took statins, they found 1 in 10 experienced muscle damage and pain, 1 in 50 developed diabetes, thus indicating that more people were harmed than helped by this drug. However, for those who already had heart disease, the results are more promising. They help prevent death in 1 in 84 people, which is 1.2%. a non-fatal heart attack in 1 in 39, 2.6%, a stroke in 1 in 125, which is 0.8%. But still 1 in 10 experienced muscle damage and 1 in 50 developed diabetes. Therefore, it is prudent to assess whether taking a statin is the right course of action for you. As we already mentioned, cardiovascular disease is a condition brought on by inflammation. Statins do have an effect on lowering inflammation, thus why they do appear to have a benefit for some groups of people. However, uncovering what is causing inflammation and making appropriate lifestyle changes will help you experience true health. After all, the body is not deficient in statins. Thus, it is critical to work out what it is deficient in and what you can do to improve your cardiovascular health. For example, it may be a combination of lack of movement, lack of sleep, lack of nutrients, stress, or toxic overload. The good news is that all of these can be improved upon, and it doesn't take a pharmaceutical drug to do so. A 2009 study, which used the EPIC study, which stands for European Prospective Investigation into Cancer and Nutrition, and out of the 500,000 individuals, analysed a subset of 23,000. They looked at how these people heeded health advice of not smoking, exercising 3.5 hours a week, eating a healthy diet, and maintaining a healthy weight. They found that those who followed these guidelines reduced risk of diabetes by 93%, heart attack by 81%, and strokes by 50%. These are incredible results, but yet often a drug is easier to prescribe. Taking medications but not addressing these lifestyle issues is likened to having a splinter and treating the pus without removing the splinter. Hopefully now you are empowered to remove the splinter and live your healthiest life. However, please note if you want to adjust any medications you're currently taking, be sure to do your own research and consult with your doctor. That sums up our lowdown on statins. Let us know in the comments below if you were surprised by the side effects of statins. And be sure to stay tuned to Heart Disease Code to learn more about preventing cardiovascular disease and discover more wonderful nutrition and wellness insights. Once again, don't leave without grabbing both of your 2 free gifts. Just click that link below. Thanks for watching. Have a heart-healthy day.